One of the more common questions I get is, what can you do for knee pain? I have pain in front of my knee. Knee pain is often referred to in the front of the knee is often referred to as a runner's knee. It's a widespread issue affecting all age groups. It typically intensifies with weight-bearing activities like walking, running, squatting, climbing, even maybe cycling, like what I'm doing now. Now, while injuries such as ligament ruptures or torn cartilage can cause knee pain, the most frequent culprit is patellofemoral pain syndrome. This condition basically arises when the kneecap is not properly aligned with the thigh bone. Such misalignment can lead to pain, swelling, and then eventually arthritis, which is what I've seen in many patients. Crucially, the knee misalignment is often secondary to primary issues in the hip, the foot, and ankle. When motion is lost in these areas, the body tends to compensate, making the knee pain a secondary symptom. Now, addressing knee pain involves treating the root cause. How can we do that? Pain reduction is the first things first. Inflammation, decrease that. You want to utilize therapy such as laser or shockwave. Now, when it comes to these tools, you need a trained clinician, not just someone who took a one-day course. There are protocols, instructions to follow. You can't just wave that wand and expect magic to happen. Number two, you need some corrective adjustments. You want to address the primary issue at the hip, foot, ankle, maybe even at the pelvis. Number three, you want to restore mobility. So you want to use a foam rolling activity to improve that femur or thigh bone alignment and exercise to strengthen the knee. Last but not least, if you're a runner, you want to replace your footwear. You want to change your shoes every 250 to 500 miles of running. You got to understand, running shoes with less than 5 millimeter heel drop decreases patellofemoral joint stress and significantly by reducing the total knee extension. That's my research, by the way. Now, what can we take away from this? When it comes to patellofemoral pain syndrome or runner's knee, sometimes it's not just a peripheral issue. It manifests sometimes as a heightened pain perception. So you have to treat it as a whole. It necessitates a comprehensive approach. You have to address the physical and the psychological aspects as well. Now, patellofemoral pain syndrome is linked to increased anxiety, depression, right, and fear of movement. So we got to address those as well. Stay tuned to part 2. We'll go over some of the exercises.